Hello, I'm going to show you the presentation of the subdural hematomas, diving a little bit deeper into the structure and anatomy. Here on this axial T1 weighted sequence, you can see a chronic subdural hematoma that is well defined by the dura that is definitely thicker than a normal dura, and this potential subdural space is expanded by the chronic subdural hematoma. Notice also that the signal density of the fluid inside the chronic subdural hematoma is higher than a normal CSF in the subarachnoidal space. On this axial T2 weighted image, we can see in very close detail what really happens in the subdural hematoma, expanding the subdural space. The hallmark is the cortical veins that are crossing a normal subarachnoidal space that you can see on this normal left side. Here you can see that the cortical veins are shifted to the sides, and they stop on the sides of subdural hematoma and not crossing it, and this is characteristic in comparison to, for example, widened subarachnoidal space. Here we look at the signal characteristics of the subdural hematoma on the susceptibility weighted images, those two top images, SWY, that are sequences very susceptible to the iron artifacts that show iron deposits in the peripheral parts of the subdural hematoma called hemosiderin. You can also see the vessels, that's normal. Now this one is a thin slice, and this is the same in the MIP, a thicker slice, so it shows even more of this hemosiderin deposits. And here we have the correlation. All the images are from the same patient, of course, on the T1 weighted sequence, as well as the coronal CT computer tomography image. Here we also see a little bit higher density of the chronic subdural hematoma. This is a cortical vein compared to the normal low density of the CSF. And finally, how does it look on FLAIR sequences? You can see the protein-rich fluid in the chronic subdural hematoma is showing high signal on FLAIR sequences. So this is quite characteristic, and you can appreciate here this is the subarachnoidal space that is compressed. Same in here, while here the subdural space is expanded. Okay, that was it. Thank you for watching. Consider liking and subscribing, and I'll see you on the next one.